are going to. I have no idea. I've never done a live feed, so I don't have any idea how many people might join in. It's going. We are we are live right now, and there are people watching. So a handful of people. I'll turn it over to you in just a second. So right now it's just me, just my ugly mug on the screen. But we got a couple of minutes. Eric Kowalski says Eric Kowalski says, "Hey Grams." Not yet, but they will here in just a second. It's 2 minutes to the official time, so well, I'll tell you one thing. Now's a good time to buy gasoline. Wow, crazy. Well, and it costs so much to store petroleum on a massive scale that it's no. Wow, that's too bad. I feel bad. Hey, Lisa's on there. Lisa Dainer. Yes, definitely. So, a couple seconds yet till it's officially 7, and then I'll introduce you guys and we'll officially get going here. Josh Secretary is on. Well, hey, Josh. All right, well, it's officially 7 o'clock. So, for all the people out there happen to be watching, welcome to the first ever live stream on my channel. Maybe the only one I'll ever do. But tonight, my son Andrew and his wife Jessina have agreed to come on and chat with us a bit. Andrew tested positive for the coronavirus, and of course, Jessina's had symptoms as well. And I'm gonna turn this over to them and let them kind of explain what they've gone through and just the history of what's gone on and that. So, Andrew and Jessina, you guys are now on the stream, so to speak.
Hello, I'm Andrew. This is Jessina, and anyway, I guess we're going to talk a little bit about how it all kind of played out for us, and it all kind of stems from kind of my fault because we had a trip planned, and I made us still go on it. We cut it short, going to Savannah, Georgia, but we flew out of Dallas, and so we'd gone down to Dallas, flew to Savannah, stayed there for a few days, and then came back, and we stayed in Dallas with family for I don't know 3 or 4 days, whatever it was, and then came back to Oklahoma, to where we live at, and so that would have been, I guess, like the 18th or 19th of March, roughly, right around that time frame. And a couple of the older kids at the place we were staying, our relatives, had said they weren't feeling great, but I mean they weren't indicative. Yeah, give me a second. Let me finish this part so they kind of know. But there were a couple older kids that had apparently had some sort of, like, they weren't feeling great. I mean, I could say that. And so we got back. Yeah, sure. Yeah, sure. Go ahead.
Okay.
Yeah.
So, first, the 13-year-old had about 2 days, no fever, felt like maybe a sore throat, just fatigued. Then the 15-year-old starts having this kind of postnasal drainage and a nagging cough that he wasn't really feeling in his chest, just here. Again, no fever. And his symptoms lasted for a little bit longer than the 13-year-olds. None of the kids under 13 have had any symptoms, period. So then that time frame is like we flew back in the 17th. So maybe the 18th or 19th, Lucas had symptoms. Maybe the 20th, 21st, 22nd, Landon had symptoms.
Yeah, roughly. And then on the Monday of that following week, I knew, when you kind of like you're not feeling great. It's kind of coming on. You know something's not quite right. It's like the pre before the storm hits. I didn't feel good. You know, I didn't know what was wrong, but it didn't feel good. And late that Monday night, I suddenly started having like a fever, pretty high fever. I think was it 102 that I got to.
So
I
he got
forget.
to 100, and it was pretty quick between him saying, I don't feel so great, that his face is like beet red tomato. And he had 100.5. I gave him Tylenol, I think.
Yeah, something like that.
And then about 2 or 3 in the morning, he'd hit the 102 mark, even with nutrient fever.
So then you had these chills, you had like aches and pains, fever, and I don't normally get sick, and so it'd been I mean, the last time I remember having a fever, I think chicken pox maybe, and I was like 6. I mean, honestly, it's been a long time, and so knew I didn't feel well. She, Jess gave me medication, and for the next day or so, I did feel better though. The next day, I didn't have like fever. I still had some chills at times. Didn't feel great. Had a nagging cough, that sort of thing. But what I've come to discover though is it's pretty nagging itself because you have these aches throughout, and it's hard to fall asleep. It kind of comes in waves. You feel better for a while, and then suddenly you're not feeling better again. And I guess I'm technically on day 10 now from when I had seen the symptoms till now to today, and I'm still not 100% recovered from hitting that. To get tested though, I did get tested, got it confirmed. That was kind of a pain here in Oklahoma, at least. We had called my primary care. She did a teleconference with me, and Jess is the medical professional, so she told her all the symptoms I had traveled, that sort of thing. So it was just kind of a home run of like, hey, you probably should have them tested. She said, no, don't test. Don't go get a test. We think you probably have it, but don't do it.
She, no,
Essentially, I mean
no,
that's essentially what she had said.
no. She didn't say
So,
don't test.
so was she
But she
just
said not to get
assuming?
tested.
No, she didn't say
She
not to
said
get a
that to
test.
me. She said that to me on the phone, not to get the test.
Was she assuming that you already had it then at that point?
No, not at first. Actually, what I did an e-visit because I didn't want him going in, and she initially sent out a Z-Pack and a Depo pack, like a steroid pack. And so then I'd sent her a message and said, this is looking more COVID versus, something bacterial or pharyngitis. So I don't know about the steroids, and can we get them tested? And that's when she called us and we talked about it, and she said, you could have it. And if you do have it, let's hold off on the steroids if that's what you think you have. But she didn't even she was like, I mean, you could have it, but we don't really know. And
Was to not test like all of it. So I'm 4 days into basically not being able to taste or smell anything, maybe 5 days now, something like that. And so anyway, we call her back then and say, hey, we really need to get tested because what's going on? Like it's pretty obvious I've got it, and it was like call me back, and she calls, but she wants me coming to the clinic, which is not the best idea of having somebody who is pretty obvious probably has it come to the clinic. So Jess got fed up and was just like, well, I'm going to go ahead and just call in a doctor's order for you, because in order to get tested like through the drive-through test that they talk about, you have to have a doctor's order to get it done. So she goes ahead and calls the State Department. They called me on the phone and set up an appointment for me, and they called me like at noon, said, "Can I be to the state fairgrounds in 30 minutes?" I said yes. They double checked my information, basic information, name, that sort of thing, and then gave me a code. I had a password code, and it was crackers of all things. And so I drove down to the state fairgrounds, and they have a bunch of cops that were down there, and they use a walkie-talkie to call in to make sure that you are who you say you are having the appointment. And then you go in even farther, and at this point, you're actually pulling into a big building, and they've got kind of rows and lanes of where you pull in at, whichever one's open. And it didn't seem like it was too busy, but there was a car ahead of me, and then there was a car behind me, so they've obviously got them staggered a little bit. And okay,
No.
the young little girl that was a medical professional. So she's got this swab, which is a very long swab, and warns me to hold my hands because apparently people, when they've swabbed people, it's gone up so far that they've reacted and have apparently pulled it out or smacked her hand or done all that sort of thing. So, you know, I said okay. So I sat on my hands, and sure enough, she was right. I mean, that thing, I mean, basically touched my brain, and they pulled it out real quick. Said, and then they said it would be 48 to 72 hours, and they would notify my medical professional, so her, to say whether or not I got it. So
Yeah, FYI, I didn't just make up a doctor's order. I can order it in the state of. I'm a nurse practitioner, so it wasn't like anything was tricked. I ordered it. I just got fed up with his doctor and finally ordered it myself.
yeah, she did that sort of thing. So anyway, so they eventually, I think it ended taking 2 days. 2 days later, they tell her I am positive for COVID. I think I'm pretty well on the mend. That first day was kind of rough, but thankfully, I'm okay right now. But I could see how it would wear you down. I could see how if you're an older person possibly or don't have the same energy, to where it's a gradual kind of wears you out. Don't get a lot of sleep, lots of aches and pains, almost like growing pains at times, and it's like different parts of your body. Now I have diarrhea. I mean, maybe that's contributed to it. Maybe it's something else that's a side effect of everything.
No, it's GI symptoms or are a sign of COVID.
So
Now, granted,
anyway,
I had him on 50 milligrams of zinc daily before he got this. I don't. When did I start it? Weeks ago.
I don't know. She keeps giving me a bunch of pills that, I mean, they could be anything. I don't know. Maybe they are those things. I don't know. Sure.
I started as soon as he started, coughing. I upped his zinc dose a little bit. The research, there's not a recommended dose, but the research does show that zinc is effective in mitigating the coronavirus effects. Just don't know how much and what exactly the dosage should be in adults.
So,
But it's more effective earlier in the disease process versus, oh, I feel sick, now I'll start taking zinc.
so Jess,
And
so a couple of questions come up. One, had you tested positive, but you didn't get tested because you didn't have serious enough
I never
symptoms, right?
I had, I wouldn't even call them cold symptoms. A day and a half before he started to feel off, so Saturday night into Sunday, I felt like maybe I was getting a sore throat, like I had some post-nasal drainage, like my allergies were flared up. The next day I thought, okay, I'm definitely getting like a throat thing, and then it just went away, and I felt fine. And about 3 or 4 days later, it hit. I woke up with almost like a full cold system going on, nasal drainage, congestion, sinus headache, and by the next day those symptoms were just gone. And I lost my smell completely. Like I shoved my face in the garlic container and couldn't smell a thing. And that's it for my symptoms. So I never would have met the criteria to get tested. Daryl wouldn't have. My sister-in-law only had, and her fevers were only at night, not during the day. She had a dry cough, but she wouldn't have met the criteria to get tested. Um, so that's why I got Andrew tested, because at least now we know for sure, and everybody in Dallas can absolutely take any precautions they weren't taking. I kept him isolated. I've kept us isolated for quite some time since we got back from traveling. So,
Very isolated.
well, have we saved lives that way?
Very isolated.
He's been stuck with me, and I just keep shoving pills in his mouth.
And I will say, I've unfortunately had been I've had been talking about this nonstop for about 2 hours every day since like December 25th or so. I think probably Christmas time, because Jess is enamored with this, and she bought.
Not enamored, terrified of something that I knew could do this globally.
She was enamored with this,
Chicken
and
Littling, the sky is falling, nobody's listening to me, calls me
she.
neurotic and a hypochondriac.
I did say all those things, and I was wrong. But she was enamored with this and started buying like toilet paper and masks. This is early January, and I was laughing. I think she found, I don't know where she found it at, but she found basically like a 50-gallon barrel of peanut butter.
It's
Like
5 pounds of peanut butter,
close
not
enough.
50
I'm missing a
gallons.
zero. There's a zero. And so anyway, I just kind of blew it off anyway. I mean, but again, here we are in this, and thankfully it's not so bad for me. But I could see how you could get worn down, and I could see how if you've got other things going on that it could very well contribute to other issues. But
I
it's
also
just
made him sleep with his head of bed at 30 degrees every night.
yeah, that was
Um,
terrible.
well, one of the big things, especially in elderly or people who might be sick, is that they might aspirate, which aspirate means that some fluid, instead of going down your esophagus into your stomach, goes down your trachea into your lungs. Well, people who, and older people just tend to get weaker throat muscles as they age, anyways. That's how they end up with pneumonia so much more often. So, especially when you're sleeping, you just want that head of bed up because then it reduces that viral load that's getting down into your lungs and then reduces that huge inflammation process that's causing all these issues. And I made him use scope 3 to 4 times a day. Certainly don't recommend gargling bleach, but anything to kind of reduce that viral load at the back of your throat. So you hopefully keep it as an upper respiratory infection and you don't let it become a lower respiratory infection was my goal with him.
Yeah. All right. So that's kind of the story, pops. What else? What else? Is that it?
I think, yeah, I'm trying to work that volume because everybody's having trouble hearing you guys. Um, and it's got to do with this software that doesn't want to. Well,
You
it
mean for
fixed
the
you up?
test or for medication?
Medication.
They gave me some antibiotics and steroid, not knowing exactly what it was. And they said if we think it's COVID, don't take the steroids, take the antibiotics.
It's azithromycin. It's a Z-Pack. It's probably much more, and they're using it much more likely to reduce the possibility of a secondary bacterial pneumonia happening on top of the viral pneumonia.
All right. So it's been 10 days, and
Yeah.
so your cough has gotten better. I did hear you cough once, Andrew, but your cough has gotten better, you think?
I think it's been nagging. Jess says she thinks it sounds better at times. I can't tell the difference. I mean, I feel like I may be coughing a little less, but it's still kind of there.
Uh huh.
Just a nagging cough.
It's better. Before he had trouble just talking for more than a sentence or two without coughing. So definitely improved.
Okay.
And he only had fever for what, less than 12 hours total
Yeah,
in
probably.
this whole shebang.
Pops.
Yeah. So I'm just looking through to see if there were any other questions that I've
Oh,
missed on that. So yeah, Josh, secretary, was wondering about that. And so, how long, Andrew, till you can like go back out into society for both of you, actually?
well, so it hit that Monday. By Thursday, I thought I was like kind of okay, like I could kind of get up and move and not just stay in one spot. And so that Thursday, I was able to get move a little bit. We had the teacher parade, which is that where you stay in your car and you drive around. And so I didn't thankfully like talk to anybody obviously, but I just stayed in my car. And we did the parade thing because I led it essentially. And I got back from that and I was wiped out. Like I did not realize how fatigued I was from it all. So that was 4 days in or so, I guess. And then it's kind of gradually gotten better, but you're still tired more so than normal. I think hard to go to sleep too is what I. The other part is that whatever, for whatever reason, that first week, there was always something like something's aching, like I said, almost felt like growing pains in your legs, or you've got chills and you just can't quite go to sleep, you know. So, like I said, I could see how it could really make you as just wear you out, over time.
So,
The answer is they don't know for sure. I've read some research articles where they were actually trying to grow the virus out in a dish. And people who were asymptomatic by day 7 or 8 were no longer shedding viral loads high enough to cause an infection versus people who had a mild course. Well, remember, they don't end up in the hospital. Those were day 10 to 11, the viral load was dropping enough. Now, remember, they're saying that people are testing positive for COVID weeks and weeks after they've had it. Well, it's a PCR test, is what they're using. So they're looking for these tiniest bits of viral shedding pieces that aren't even, they're not even looking for the entire virus. So just because you test positive in a PCR test 3 weeks after you've had this doesn't necessarily mean that you're still infectious.
so what are
That's how
they?
much of a viral load are you shedding.
So what are they saying in terms of guidance for you? Like, do they tell you, okay,
They
you?
don't know yet. I don't think that there is a guidance because the real guidance is that they want you to have two negative tests within 24 hours. Well, guess what? We can't even get people tested who are positive. They're not going to waste tests on testing people who've recovered from it. We don't have that capacity at this point. So, guess what? It's not like he got a call from the State Department telling him how long to stay quarantined. They're leaving that up to providers. And so for me, I would say at least probably 2 weeks from the start of your symptoms, and
Wow.
maybe more depending on how long he has the cough.
Yeah. So a question, Andrew, was one of the people watching had was is this worse? Do you think than the regular flu? I mean, have you had the regular flu?
I Now I work at a school, so I feel like I rarely, like my immune system is pretty well built up. I rarely get the regular flu, even though people around me may get it. Um, I've not had a fever in years and had one, so it's a bunch of like weird, bizarre things that are to me are associated with it, like these weird aches. And I even for the first 3 days, like first 3 or 4 days, and I'm blaming Jess for giving me some pill, but I had like a sunburn feeling on my back. Like it felt like it was sensitive to the touch, like a sunburn would feel on my back.
He was that bitchy old patient. What are you giving me? Oh, why am I having
I
to take a pill again?
seemed like a
Pills make my back feel
seemed like some
sunburned.
reaction to it. But anyway, so is it the worst thing I've had? I mean, I don't know. I mean, it's bad enough, I guess. But I could see how if I could see how he could wear you down though, because it comes in waves. It's hard to go to sleep. You get tired. Like I could see how, and you don't eat like the first week. I didn't eat. Like I lost 7, 8 pounds, something like that. Because you don't want to eat anything. You're tired. You're exhausted. You know. So again, I could see how it could wear you down, and then I think that's once that happens, you're immunocompromised.
Well, I don't think that they entirely know why, but if you want to compare it to the flu, people who end up on a ventilator due to viral pneumonia, their average time on a ventilator is 3 to 4 days. The average time for a COVID patient to recovery right now, if they recover, is 11 to 21 days on the vent. So it's not viral pneumonia like what the flu causes. It's worse, and it seems to be worse in men. It hit Andrew much harder than it hit me.
Yeah.
And in the critical care, it's 2/3 of patients are men who end up in critical care with this. So
Wow. So Josh was mentioning that uh, in the military they make you be quarantined for 14 days from when you got symptoms, but maybe that isn't really quite long enough, huh?
I don't think so because I still have this cough, and it's like day 10 so I obviously had it before I showed the official symptom.
Uh huh.
You know what I mean? So I don't think for I mean if you're going to be certain, I mean it's got to be longer than that at this point, at least for me. You know.
if we hadn't been in Dallas and I knew that there was community spread in Dallas, and if Andrew hadn't had a fever and a dry cough like he did, I probably would have just said, "Oh, my allergies are acting up." I wouldn't have even felt that I had this.
Yeah, for Jess.
Wow.
Versus he felt, I mean, the worst that I've seen him, and we've been together 13 years, and I've never even seen him spike a fever, even strep. So
Very consistent body temperature.
Wow, pretty crazy. Well, I'm glad that you're both, especially Jess, I'm glad you didn't get any serious symptoms to speak of. And Andrew, I'm glad you're on the mend on there. But yeah, it's pretty crazy times for sure. You guys got anything else you wanna add?
I don't know. Don't get it, so you don't have to have that swab. Oh my God.
get in touch with your senators because this isn't going to stop until we are testing people.
Well, yeah. Okay, there you go. There's a point. And an example, since my friend Chad, who lives in Minnesota, I forget what the exact numbers were, but they had tested something around 16,000 people, and they had 500 confirmed cases. Well, Oklahoma had tested at the time we were comparing them, had tested 2,000 and had like 700 confirmed cases. So that tells you Oklahoma has many more cases that probably aren't confirmed out there that are walking around, running around. So,
I Andrew did not want to do a lot of the isolation things that I wanted to do. And because I'm neurotic and on the safe side, we probably ended up not infecting a lot more people than we could have. But if we were just general people who didn't have that background medical knowledge, because the government wasn't telling people to isolate at that point, we could have infected so many people. This is so easy. This is so infectious. The only way you're going to be able to open the economy back up is not, we don't need to worry about testing hospitalized people. They're hospitalized. We know what they're hospitalized with, we know what they're sick with. We need to worry about testing these people out in the general public who aren't hospitalized or who may have mild symptoms, because right now, like in Oklahoma, we're catching 25% of cases. That doesn't stop a pandemic. You need to be catching like 90% of cases, right? And so we need to start building up to that. And the only way that's going to happen is if we put pressure on people.
Right. So Josh was saying that actually the time's a lot longer in the military. That was uh, if before you got tested, and then if you tested positive, then it's a whole different thing.
oh yeah.
Yeah, they have to have negative tests, but they can get tested in the military.
I wonder what, because Gary Kurtzels, he went to Brazil and came back here recently. I wonder how long they quarantined him for. 14 days maybe. He's in the military when they came back. They had like a separate little holding station on some base when he came back.
And remember, when they were letting these people out of quarantine, if they had been positive, it was because they were getting two negative tests within with greater than 24 hours apart. They can't do that now because we don't have that testing capability. So
So,
there's not a general guidance.
but one of someone that came on a little later, Michael, was wondering about the experience at the hospital. But you guys never went to the hospital. It was strictly
No, yeah, we did a teleconference with um, the primary care, and then then I did the drive-through test. So I never went to the hospital. I never had to go, thankfully.
But we can tell you what's happening in hospitals, which is that you can't go in with your family member. If you're sick, it's you in the hospital.
Yeah, correct. They are limiting that.
So that's it. And then what most hospitals are doing right now is that they'll have COVID floors or COVID ICUs. So a friend of mine who's an ICU nurse in New Jersey, what they did is they took their post recovery unit and their medical ICU and their even all of their step down units, and they turned them all into COVID ICU. And as of last week, all of those in a very big hospital that you could compare to OU or larger were full with COVID. So they'll try to keep clean and then COVID, But remember, they also don't have the PPE. A lot of these nurses are wearing the same PPE between patient to patient to patient. So I don't know how this isn't going to spread in hospitals unless we get them the stuff that they need. If you can stay out of a hospital, stay out of a hospital. Video conference with your doctor. You know, they can send oxygen to your home, especially if you deal with one of these hospitals that has the capacity for that. The rural hospitals don't have that built in. A lot of these larger hospitals already have virtual visit capability.
So,
Um,
so they're wondering. Lisa's wondering, uh, what advice would you give to somebody that thinks they might have it?
Get tested. Like I don't.
Push for testing.
Yeah, make them test you
Insist.
because she really wasn't gonna. Even when we called back that second time, I mean, she was like, "Nah, you don't need to test. We can have you do it at the lab, I guess, if we need to, but you really don't need to. Even if you think you have it, if you're showing minor symptoms, don't do it." But it's like that's the exact wrong way of doing it.
Yeah, because right now they're like, oh, well, we'll save the test. And now they're starting to move it towards the right direction, which is we're going to test the people who are at risk, who have symptoms, mild symptoms, and we're going to test the healthcare providers. And so a little bit of is that depending on where you live in your state, if you have a shortage, you may want to make sure that healthcare providers get tested. But if you've been in contact with people and you know that you need to do some tracing down the line, push to get tested. But remember that our doctors and our nurses all need to be tested too, so that we don't have infected healthcare providers out there giving care to patients and transferring it to them.
So I guess what you'd say is that if you have pretty reasonable suspicion that you're infected, that you should probably go ahead and get tested.
Yeah, 100%.
But it still depends right now, state to state, because it's not consistent. In New York City, it would be a different story
I will.
than here.
Well, let's tell Storo. Let's tell his story real quick, which is our friend Aaron Storo, who lives in New York City. Sorry, HIPAA violation here, Storo. Um, but he interacted with a number of people. I mean, it may have ended up being like 3 or 4 people for sure that ended up getting COVID and had it. And he qualified to be tested, and he lives in Manhattan. And he called their hotline, and they said at the time, it's been probably a week and a half now, but he had called and they told him, yes, you qualify to be tested, that we will call you back within 3 days time and then set up a time to test him. They called him back and then said, we're not going to test you and didn't test him. Now he hasn't got the symptoms at this point, so it looks like he's probably not sick, but it sure seemed like there's a real good chance he did have it. And he could have been a carrier for all we know, but they didn't test him in New York City when they probably should have. You know, I know they're swamped. I get it, but I don't know. Doesn't seem good to be not testing like we should be.
All right. Well, you guys, thanks for doing this. It's
Yeah.
I'm using this software that I don't think's the world's greatest for streaming. The other choice was a $700 package, so you can probably see the difference between this and a $700 package. But anyway, hey, yeah, thanks for doing this, you guys, and thanks for everybody that tuned in. And I'm pretty sure it is. I'm pretty sure I've got my headphones in. She normally knows when I'm, talking. you know that. Yeah. That. So anyway.
Um, and I think they'll figure out a treatment before we get to a vaccine. But be patient and stay in and don't take unnecessary risks because
Or either get it now and be done with it, or don't get it at all so you can save our football season. All right?
There you go. Get it early. You know that if I that I guess when I switch, it drops you guys out of the thing, out of the audio. But um,
No, that's all good.
anyway, all right, you guys, take care, and
All right.
Love you.
Love you, Pops.
all right, love you guys too. Bye bye.
Bye bye.
All right, well, I'll say goodbye, everybody. Thanks for tuning in. I can kill that stupid thing. All right, bye, everybody.